Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Alzheimer's disease. You know, the Alzheimer's Association estimates that there are nearly 6 million people in the United States who have the disease. Now, here are some sobering statistics. 1 in 10 people over the age of 65 have Alzheimer's. 1 in 3 people age 85 and older have Alzheimer's. It's predicted that the number of people with Alzheimer's disease in the United States could more than double by the year 2060. And Alzheimer's is now the 6th leading cause of death in the United States.
Talk about a disease that's not only affecting more and more people, it's also a condition that, despite researchers' best efforts, it's still hard to diagnose and even harder to treat. Joining us in studio with an Alzheimer's update is the director of the Mayo Clinic Alzheimer's Research Center, Dr. Ron Peterson. Welcome to the program. It's great to see you.
Well, thank you so much for having me back.
Dr. Peterson, nice to see you. I doubt that there is anyone in the world who has spent more time, more effort trying to unravel the mysteries of Alzheimer's disease than you.
Is that your way of saying I'm a bit long in the tooth?
Well, no, not exactly. I just remember that you and I have been talking about this disease for nearly 30 years on the radio.
That's correct. That's right.
What has changed in 30 years?
Well, as you were saying, Tracy, I think our ability to diagnose the disease is much better than it was 10, 20, 30 years ago, because we can be more precise now, not only on the clinical side, but on what we call the biomarker side. By biomarkers, we mean blood tests, imaging tests that in fact tell us this person has Alzheimer's disease in his or her brain.
I would think that something else that changed is much like cancer, where it used to be, don't say the C word. Alzheimer's disease is actually something that people talk about now. It's okay to talk about it.
It's getting better.
Okay.
We're not there yet. It's a good analogy with cancer because, as Tom and I know years ago, you'd say the C word rather than saying cancer. But to be honest, I think part of that progress has been driven by the fact that we can now treat some of these diseases. Alzheimer's disease still remains an enigma.
Do you ever get frustrated that we haven't made more progress in the treatment of Alzheimer's?
Yes, I do. I mean, really, when you think about it, we have some symptomatic drugs that we offer people when we make the diagnosis of Alzheimer's disease, but we don't have that disease-modifying therapy. And by that, I mean something that gets at the underlying biologic process itself, stops it, reverses it.
So tell us the difference between Alzheimer's and dementia and what we mean by the term dementia.
Well, dementia means that this is an overriding condition where the person no longer remembers as well as he or she used to, probably affects other aspects of thinking, and it impacts their daily function. So cognitive function, cognitive failure now impacts your daily function. So that's dementia. Then you ask the question, what's causing the dementia? So is it due to Alzheimer's disease, which is a degenerative disease of the brain? The nerve cells aren't working as well as they formerly did. Could it be due to small strokes? Could it be due to the side effects of medications you're taking for your other conditions? Could it be depression, anxiety, psychiatry? So dementia is a syndrome, a clinical picture, and then it's caused by something. Now, in fact, in aging, up and away, Alzheimer's disease is the most common cause of dementia.
What do we know about cause? It seems like for many years we had no idea what caused it, and now it seems like there may be multiple factors.
Well, if you define the disease by the presence of these plaques and tangles in the brain, plaques made up of the protein amyloid, tangles made of the protein tau, we think there's a genetic susceptibility, so it tends to run in families. There are rare but real genetically caused forms of the disease. But in terms of environmental factors, where there's some associations but no real definitive causes of the plaques and tangles in the brain.
It seems to be more common in women. Is that because it is more common in women, or women just because women live longer?
Well, that's a controversial topic right now. I think it is true. Women do live longer, and the biggest risk factor for Alzheimer's disease is age, so there are more women with it. But there are also some biologic predispositions. It could be hormonal, it could be some of these genetic characteristics like apolipoprotein E that may behave differently in women than they do in men.
Tell us about the symptoms. You mentioned memory loss. I presume that that's the most common symptom, but what are some others?
The most typical symptom is, in fact, forgetfulness. And now we all get a little more forgetful. I don't know about you, Tom, but I'm a little more forgetful than I used to be.
I understand.
And so I think forgetfulness is part of it, but it's beyond the forgetfulness of aging. So when people start to forget information that they formerly remembered quite readily, those around you who know you well start to realize, hey, Dad, you're forgetting that thing you used to remember quite readily previously. It's a repeated pattern. We get concerned. But then it goes beyond memory. So now we have trouble problem solving. We have trouble word finding. We have trouble maybe finding our way around the community, getting lost in areas that we formerly knew quite well. And so those are the symptoms as they come on very gradually and very insidiously over years that lead us to be concerned this might be beyond what we would expect for normal aging.
I think one of the first times that I ever sat in on an interview with you, I heard you say, Alzheimer's is not, I can't find my car keys or I can't find where I parked my car. Alzheimer's is, do I have a car? I mean, is it also that you don't realize that you're forgetting these things? I mean, I've got so many friends that get so upset that they forget things.
Sure.
And I'm like, from what I understand, that's not Alzheimer's.
Well, what you're describing, Tracy, is perhaps Alzheimer's disease in its more advanced stages. So one thing that's happened over the years is we do pick up on these earlier signs now. So, right, where are my reading glasses? Where are my car keys? That's virtually everybody. Everybody has trouble coming up with the name of that person with whom I used to work, saw him in the grocery store. Who is he? 3 aisles later, of course, that's Bill. How could I forget Bill? But when that advances to now you're forgetting information that you formerly should know, that becomes a little more problematical.
You like your wife's name. Yep.
Okay.
So, is it because does Alzheimer's always first affect the memory part of the brain? Is that why that's the most common symptom, or do we know?
It's the most typical presentation, and the part of the brain that gets involved initially with Alzheimer's disease is the memory part, the temporal lobe, a structure called the hippocampus. That's usually the beginning. But there are some atypical forms, and actually in individuals with younger onset disease, the presentation may be quite atypical. What I mean by that? There's a rare form called posterior cortical atrophy, or the visual variant, where people really have difficulty with visuospatial relationships. They may go to the eye doctor first. Eye doctor says, gee, your vision's fine, but I'm not processing visual information. That's because that part of the brain becomes involved initially in those individuals. There's a language form for where the word finding problems, the understanding language, the communication really gets impaired out of proportion to, say, the memory part. There's even a frontal form, a behavioral form, where people's personalities start to change. They become a different person to the family. Rarely that can be a presentation of Alzheimer's disease as well.
Does it ultimately affect the entire brain?
It will as it progresses. I mean, there are certain parts of the brain that are relatively preserved. Motor functions, sensory function usually hangs in there pretty far into the disease process, but ultimately it affects everywhere.
So what about life expectancy? It does shorten your life, correct? And what's
Correct.
the average life expectancy following diagnosis?
Well, it's very variable, and we sometimes see people who have an aggressive form of the disease who may pass away a few years after diagnosis. We have those who go out 20 years after the diagnosis. But in general, 8 years plus or minus from the time of diagnosis till the time of death, if it's diagnosed, say, in the early 70s or in the 80s.
Is that the same as it was 30 years ago? 8 years?
Basically, it is, yes. That's
And what
not
are
That
these
is frustrating.
What do these people die of?
Well, usually if people go to the later stages of the disease, motor function, swallowing, some basic autonomic functions will become impaired. A person may aspirate, get pneumonia, and die of a medical complication of the brain not handling our motor functions very well.
All right, our guest is the director of the Mayo Clinic Alzheimer's Research Center, Dr. Ronald Peterson. Time for a short break. When we come back, we'll talk about what's available for treatment, and we'll also tell you what you can potentially do to prevent the disease. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are with the director of the Mayo Clinic Alzheimer's Research Center, Dr. Ronald Peterson. We've talked in general about Alzheimer's disease. It's a devastating disease for a large number of people, some 6 million in the United States. We want to talk a little bit about not only what's available for treatment and prevention, but also a little bit more about diagnosis, because you did say, Dr. Peterson, that we're better now at diagnosing it than we used to be. And what did you mean?
Well, now we have the availability of these biomarkers that actually characterize the underlying biology of the disease. What do I mean by that? Alzheimer's disease is plaques and tangles in the brain. Plaques are made of this protein called amyloid. The tangles are made of the protein called tau. We can now see those proteins in the brain. We can do PET scans that actually light up those regions of the brain if, in fact, they have plaques and tangles there. We can do a spinal tap, and we can detect proteins in the spinal fluid that give us an index of what's going on in the brain. So if a person becomes forgetful later in life, you think it might be Alzheimer's disease, we can now clarify it is in fact Alzheimer's disease, as opposed to some other conditions, small strokes, other proteins that may be misprocessed in the brain. So we can get much better with regard to the specific diagnosis now.
But first of all, a PET scan is an expensive test, several $1,000s. So is it important to know, and is it worth spending the money for that test?
Well, I think it's important to know if the person really wants to find out. It's very important for the design of clinical trials. So if we're testing out some new experimental medicines, it's very important for us to know what in fact exists in the brain. But you're quite right, Tom. The cost of these tests is many thousands of dollars. Clearly not the way to go on a population-based, but for research, it's important.
All right, what about a blood test? We saw a headline just today sent to us by one of our colleagues that said, Alzheimer's blood test, quote, one step closer, unquote.
So, as you were saying, these PET scans, which are quite definitive with regard to the diagnosis of Alzheimer's disease, are expensive and certainly not available everywhere around the country. What these recent studies have indicated is that there may be measures in the blood now that do in fact tell us whether somebody has amyloid in the brain. It's not a yes-no yet, but it helps us at least narrow down the general population as to which individuals might benefit from these more expensive, more invasive tests like PET scan, spinal fluid. So, for example, here in Olmsted County, we're doing the study called the Mayo Clinic Study of Aging, and we draw blood on individuals who participate in this study, and we follow them every year. Those blood samples now that have been frozen away for years are being sent to these laboratories to tell us who, in fact, in the population might be more susceptible to having these proteins in the brain.
Do you want to know, obviously, the sooner you can know this, the better off it is, but is that because you can tailor the treatment a little bit better if you know before they start showing symptoms that they have got a possible?
You wish.
Yeah.
Right, exactly. That's the hope for the field, Tracy, and we haven't done very well on the therapeutic side thus far, but that is in fact the thinking, that if we can identify people who are at risk even before they become symptomatic, before they become forgetful, we may be able to intervene with a disease-modifying therapy if and when, hopefully when, we develop these.
If that's the future, what is treatment now?
Well, right now we talk about some symptomatic drugs that can alter certain chemicals in the brain that may help us with our remembering, keep us stable for a little longer, but they don't get at the underlying disease process itself. We still talk about lifestyle modifications because, believe it or not, things like exercise, physical aerobic exercise, may be beneficial. I won't go as far as to say prevent Alzheimer's disease, but it may slow down the course, delay the onset a little bit, much as we do in heart disease. We don't necessarily prevent heart attacks, heart failure, but if we can push that back by 2, 3, 5 years, that's a big deal. We're hopeful that we can do that with Alzheimer's disease as well.
But you didn't talk at all about the drugs that you have available, and I think there's a reason for that, isn't there? I mean, they're not all that effective, and are they expensive also?
They're not very expensive now because they're generic by and large, but believe it or not, we've not had a new drug approved for Alzheimer's disease by the Food and Drug Administration since 2003.
Really?
16 years, despite billions of dollars being spent on the development of therapies.
Why? Is it that you're not looking in the right spots, or
Well,
why is
it's
that?
a tough nut to crack, actually. So we talk about these two proteins, amyloid and tau, getting at them, getting in the brain, getting the drug into the brain, removing the protein or stopping from being misprocessed is an important target, but we've really not been able to demonstrate. We can get drugs in the brain now to remove that protein, the amyloid protein, but we haven't been able to demonstrate that it makes any difference clinically. Now, there are a lot of reasons for that, and it's a much more complex situation than just amyloid and tau itself. There are other proteins that get misprocessed in the brain, a protein called alpha-synuclein that causes Lewy bodies associated with Parkinson's disease, another protein called TDP-43, which in and of itself can cause memory impairments in the brain. We have vascular disease. Small blood vessels get closed off. And in most people in aging, in their 70s and 80s, it's a combination of those factors. So amyloid and tau are important components, but they're just components of a complex process.
All right, let's talk about prevention, because all of us want to do what we can to not get Alzheimer's disease. So tell us about the World Health Organization guidelines for risk reduction of all kinds of dementia, actually.
Right. So the World Health Organization came out with a paper earlier this year that was describing certain lifestyle factors that may in fact deter the onset of dementia. Now, I must clarify and say they were talking more about dementia in general than they were specifically about Alzheimer's disease. Nevertheless, that's very important because it may be that these lifestyle modifications, again, aerobic exercise, staying intellectually active, a heart-healthy diet, remaining in your social networks, social connectedness, may actually defer the onset of mild cognitive impairment or dementia or slow down their progress. So these are important findings, and in particular, the World Health Organization speaks to everyone, but to low and middle income countries in particular. And that's where the rate of dementia is increasing most rapidly, because these countries are experiencing an increase in aging. Again, the biggest risk factor. So it's a really important document.
Dr. Shives earlier said, you've been working on this for 30 years. Do you get frustrated that you're not farther ahead in this? I want to know the opposite. Is there something that is exciting? Obviously, you have been working on this for so long. What excites you about coming in and finding a cure?
Well, I think we're getting close. I do, and I don't mean we have the magic drug around the corner, but I think we're learning so much about the underlying disease, the biology of the disease, the characteristics, what may modify its onset, delay its progression, that I think we're getting very, very close. And I would suspect that we will be able to come up with a combination of disease-modifying therapies with lifestyle recommendations that may, in fact, have a real impact.
So those WHO guidelines also indicated that smoking wasn't good, and I guess that doesn't surprise anybody, and alcohol in moderation. One other thing I want to ask you, is there any evidence that there are any over-the-counter vitamins or supplements that will help prevent Alzheimer's disease?
The short answer, Tom, is no. There's a recent report by AARP on this very issue. If you want to Google, the Global Council on Brain Health just reviewed this whole area and came to the conclusion that if a person does not have a deficiency state, meaning they're low in B12, they're low in vitamin D, they're low in calcium, if all those levels are normal, taking supplements will not help you, will not augment your performance, make you live longer, or anything of the sort. It's a $40 billion industry out there right now, and there's really very little data to support any of it.
Well, hopefully you have just saved our listeners a lot of money. Dr. Ron Peterson, director of the Mayo Clinic Alzheimer's Research Center. There are 6 million Americans living with Alzheimer's disease. It affects 1 in 10 people over the age of 65, and the older you get, the more likely you are to be affected. There are now better ways to diagnose Alzheimer's disease, but there is still no definitive, inexpensive test that can confirm the diagnosis. Treatment, a few drugs that can possibly slow the progression, but so far, nothing that will stop it. But researchers like Dr. Ronald Peterson are optimistic. Our thanks to one of the world's Alzheimer's experts, Dr. Ron Peterson.
Thanks, Tom and Tracy. I appreciate it.